For those misfortunate enough to be in a devastating auto collision, it's crucial to get appropriate diagnosis and treatment by a coordinated team of physicians who can manage the different aspects of your care right away. Even these minor crashes may cause more severe injuries later due to delayed presentation after the shock of the event has worn off. Keep watching to find out what doctors you might need to see after a car accident. Primary care physician. Surprisingly, many family doctors refuse to treat their patients for car crash-related injuries due to the scope of damage the victim sustained. If you were in an accident, your doctor might refer you to a specialist, like a chiropractor or an orthopedist, to treat you instead. They may not have enough specialized training to evaluate you appropriately. Services your primary care physician can offer you after an auto accident include referrals for further treatment, documentation of your stated injuries, general pain management advice, and follow-up care as recommended by other referred doctors. Chiropractors. Chiropractors offer a variety of spine-related treatment options for victims of car accidents. Their education in the treatment and diagnosis of spinal and surrounding soft tissue injuries make them an important part of your recovery. When visiting a chiropractor, you may have to get x-rays of your spine taken, submit a complete background history on your health, and have a comprehensive physical exam. Your chiropractic care provider will then give you an appropriate diagnosis of your injuries and create a care plan to get you back to health. They are central to your care after an auto accident and will refer you as needed for other service providers like neurologists and orthopedists. Orthopedists. Orthopedic care involves the musculoskeletal system, and its physicians offer a wide variety of treatment options that include surgical and non-surgical techniques. Using an orthopedist isn't that unusual after a car crash because of the seriousness of injuries one gets. Many who visit an orthopedist following a car wreck suffer from one of the following common injuries: hand and finger fractures, torn ligaments like the ACL or MCL, herniated spinal disc, fractured hip, and more. Referrals to an orthopedic specialist aren't necessary, but many choose to speak with their family or chiropractic care physicians first. Neurologists. After an accident, it isn't uncommon to have delayed symptoms show up a week or even a month later. The initial trauma of an auto crash causes some victims to shake off neurological injury symptoms as just temporary. When signs of trauma like headaches or nerve pain in the extremities appear a short time later, it's imperative to include a neurologist in your treatment plan. Neurology is a broad branch of medicine that includes treatment of your entire nervous system. Your brain, spine, and even the nerves in the tips of your fingers fall under a neurologist treatment specialty. Professionals in this field receive specialized training to recognize early the symptoms of nerve injuries and immediately treat the issue before it becomes more serious. Common neurological symptoms after a car accident include headaches that are minor and/or severe, tingling and/or numbness in an extremity, and loss of power or weakness in an extremity. Any of these doctors will have the expertise and treatment network available to begin your care right away. This can only happen though if you get checked out as soon as possible after the initial collision. Any type of sign or symptom of what you believe to be an accident-related injury deserves evaluation so that you can prevent potential complications down the road. Contact us for more info. And if you enjoyed this video, be sure to like, comment, and subscribe.